Welcome to Soul Society. In this video I will talk about how to treat vaginal mycosis with phytotherapy and aromatherapy. Vaginal mycosis is an infection, not sexually transmitted, located at the vulvovaginal level and due to a fungus, most often Candida albicans, nearly 90% of cases, more rarely Candida glabrata or tropicalis. It is characterized by symptoms that are not serious, but bothersome: itching, white discharge, leukorrhea, devoid of an unpleasant odor and whose texture is reminiscent of curdled milk, burning sensation, local inflammation, pain during sexual intercourse. Remember that the vagina is normally protected by a bacterial defense population, the doder-line flora, the composition of which can be destabilized under the influence of various factors, like so many open doors to the proliferation of undesirable germs. Thus, following the imbalance of this ecosystem, Candida albicans, naturally present in the vaginal flora, in the form of yeast, can transform into its pathogenic filamentous form. The factors favoring the imbalance are multiple: hormonal fluctuations during the cycle and/or at certain periods, pregnancy, menopause, deficient immunity, cancer, HIV, etc. Certain diseases such as diabetes, sugar promotes implantation of Candida albicans, or hyperthyroidism, acidity of the vaginal environment, multiple sexual practices, external sources of inflammation, tight tights or pants, tampons, unsuitable washing products, excess or insufficient hygiene, etc. Long-term medications such as corticosteroids and especially antibiotics, which are the fungi that destabilize the intestinal and vaginal microbiota. In the event of recurrent mycosis, pregnancy if the mycosis affects a prepubescent young girl, in the presence of pain in the lower abdomen and/or fever, higher risk of infection in the genitals. Hygiene: if the infectious episode lasts, temporarily use, approximately 15 days, a specific washing product with an alkaline pH, 7 to 8.5, intended to limit the proliferation of yeasts, in pharmacies. Rinse, then dry carefully with a clean cloth, or with a hair dryer. Fungi develop in a humid environment. Apart from this episode, opt for a neutral or slightly acidic pH product that respects the natural vaginal pH. If you have repeated candidiasis and to prevent recurrences, avoid all scented products, intimate deodorant, etc. Prescribe vaginal douches as well as soaps that are too antiseptic or aggressive. Maluka liquid soap, in pharmacies, is perfect for daily use. Alternatively, you can simply add tea tree essential oil to your usual cleansing product, 100 drops for 250 milliliters of liquid. Shake well before each use. Prefer cotton underwear and limit the wearing of tight clothing, a source of friction and irritation. In the toilet, wipe the vulva and anus front to back to prevent the passage of intestinal germs to the vagina. In case of recurrent fungal infections, avoid the swimming pool in places of maceration and humidity. The most important thing is to limit sugar, especially in the case of recurrent fungal infections. Local care and compliance with food and lifestyle advice are usually enough to relieve and eliminate pathogenic Candida. Oral treatment will only be necessary in the event of recurrent fungal infections. Not recommended when all is well. Vaginal irrigation can be offered during periods of vaginismus to gently cleanse the mucosa, accelerate healing, and accentuate relief. Their use is also justified to eliminate any trace of medicated gynecological ovum excipient which continues to adhere to the vaginal wall, constituting an environment conducive to recurrences. Douching is done with plant decoction or active hydrosols on all fronts: infection, itching and inflammation. Herbal tea or hydrosols can also be used as a lotion, soaked compresses, or as an external spray on the vulva area to relieve irritation and local itching, as often as necessary. Herbal decoction: burdock, root, bramble, leaf, alchemilla, areopart, walnut, leaf, white dead nettle, flowering top, red rose, petal. Choose one or two plants, for example, burdock and bramble or bramble and dead nettle, etc. Prepare a decoction with 4 heaped tablespoons of the mixture cut into small pieces for 500 milliliters of cold water. Bring to the boil and keep simmering for 10 minutes, cover and let infuse while cooling. Fill the vaginal bulb syringe and proceed with vaginal irrigation, once a day, and only in times of infection. In case of severe itching, you can also opt for a localized lukewarm bath, based on sodium bicarbonate, 1 tablespoon for 500 milliliters of water. Echinacea, root, and dead nettle, flowering top. These two plants combine their immunostimulant, echinacea, and anti-infectious genitourinary properties, white dead nettle. To be taken, preferably in liquid form, 5 milliliters of sipped, integral suspension of the fresh plant, of echinacea, 15 to 30 drops of hydroalcoholic extract of white nettle twice a day, in cure of 10 days per month, for 3 months. Echinacea is contraindicated in people allergic to Asteraceae, arnica, mugwort, marigold, feverfew, etc. It is not recommended for prolonged treatment without medical advice, in autoimmune or progressive diseases, tuberculosis, AIDS, etc., in the event of hemochromatosis. The white dead nettle is not recommended in case of conditions contraindicating stimulation of prolactin and growth factors. Hydrolats. Mix equal parts of pure lavender and chamomile hydrosols, fill the vaginal bulb syringe and proceed with the irrigation following the same procedures. Antifungal ovum. It is not always easy to prescribe antimycotic gynecological ovules based on the essential oil. Tea tree essential oil, 25 mg, Matricaria chamomile essential oil, 25 mg, palmarosa essential oil, 25 mg, fine lavender essential oil, 25 mg, calendula oily macerate, 100 mg, Tepsol excipient for 1 ovum of 4 grams. Put an ovum in the evening for 12 days. In the case of recurrent mycosis, put 1 ovum at bedtime 7 nights in a row, then continue 1 night out of 2, 15 days a month, for 2 months. During the 15-day break, take the opportunity to restore the vaginal flora based on prebiotics and probiotics, in pharmacies. Contraindications for this formula: pregnant or breastfeeding women. In the absence of an ovum, opt for a simple and effective home solution. In an opaque 30 ml bottle, put in mix tea tree essential oil, 6 drops, chamomile essential oil, 6 drops, palmarosa essential oil, 6 drops, fine lavender essential oil, 7 drops, nigella vegetable oil, 10 ml, calendula oily macerate, 30 ml. During mycosis, pour a little of this complex on an organic vaginal tampon to impregnate it 2/3. Put a new tampon at bedtime, 7 to 10 evenings in a row. Also, apply a few drops of the oily complex externally, on the vulva. In prevention, the aromatic oil can also be used directly on the vulva, after menstruation, in the premenstrual period, after the swimming pool, after sexual intercourse, etc. Contraindications for this formula: pregnant or breastfeeding women. It becomes necessary in the event of recurrent mycosis or if the mycosis has declared itself following antibiotic treatment. It is therefore urgent to restore the balance of the two flora, intestinal and vaginal. Organic grapefruit seed extract, active at low doses. It has the advantage of broad-spectrum antimicrobial activity while preserving and strengthening the balance of microbiota. The best protocol against stubborn fungal infections is to take grapefruit seed extract in progressive doses: 1 dose per day the first week, 2 doses per day the following week, 3 doses daily the last week. By referring to the dosages indicated about the weight, according to the brands. The treatment must often be extended for 1 to 3 months, alternating, or not, as a 3-week cure with the other options. As a precautionary principle, grapefruit seed extract should be taken without any other medication, 3 to 4 hours apart. Helonius dioica 5ch and Hydrastis candidiasis 5ch. In addition to antifungal treatment, these 2 remedies are active in the event of viscous white discharge with heaviness in the pelvic area and vulvar pruritus, 3 granules of each, 3 times a day. If it is the Candida albicans germ, take more Monelia albicans in increasing doses. Monelia albicans 5ch, 3 granules morning and evening, the first week. Monelia albicans 7ch, 3 granules morning and evening, the second week. Monelia albicans 9ch, 3 granules morning and evening, the third week. Monelia albicans 15ch, 3 granules morning and evening, the fourth week. Everything about the vagina is correlated with sexuality and could symbolize a physical or moral impediment. Essential oils are no harmless remedies. Seek the advice of a doctor before taking any medication. If symptoms persist, consult a doctor. Try a patch test before using an essential oil topically. To perform a patch test, place a diluted drop of oil onto a small part of your skin. If you develop dermatological symptoms, wash it off and do not use that oil on your skin. Not recommended for pregnant women. Ask your doctor or pharmacist for advice before taking any medication. In the next video, I will talk about how to treat stings and bites with phytotherapy, aromatherapy, and homeopathy. If you like this video, subscribe to Soul Society, and check out the description below to get more information. Thanks for watching.